Hi, my name is Dr. Roychowdhury, or Dr. Roy for short, and I'm a family medicine doctor. Quick disclaimer, the tips and information discussed in these videos does not replace medical advice and treatment from your own provider. Make sure to discuss any questions or concerns with your own medical professionals rather than relying on only this information. In this video, we will talk about the different types of medications used for diabetes. Remember, in diabetes, the sugar you eat can't get to where it is needed to make energy, and it ends up staying in your blood where it damages your body. So, the medications work in different ways to lower the sugar in your blood to normal levels. Not all medications work well for every person, so your doctor will help you figure out which is the right medication for you. We'll talk about 9 different types or classes of medications that can help lower your blood sugar levels. This video has a lot of information, and it can be overwhelming. To help you focus on the information most relevant to you, we'll name the medications in each class before explaining how they work. So keep an eye out for your medications as we go. Remember, you can come back and rewatch this video as many times as you'd like. Biguanides. Metformin, one of the most common diabetes medications, is a type of biguanide. Metformin works in 2 ways. First, it helps get sugar out of your blood and into your cells. Some sugar in your blood comes from the food you eat, and some comes from your own liver. Metformin also works by telling your liver not to make as much sugar. Sometimes when people first start taking metformin, it can cause diarrhea, but this usually gets better with time. Some people also find fewer side effects when taking the medication with meals. DPP-4 inhibitors. Another class is called dipeptidyl peptidase 4 inhibitors, or DPP-4 inhibitors. Examples of medications in this class are alogliptin, brand name Nesina, linagliptin, brand name Tradjenta, saxagliptin, brand name Oniglisa, and sitagliptin, brand name Januvia. These medications help the body make more insulin when blood sugar is high. Remember, insulin allows sugar to leave the blood and go into cells where it is used for energy. The good thing about DPP-4 inhibitors is that they typically do not affect weight. They also do not cause your blood sugar to drop too low and therefore often do not cause symptoms of low blood sugar, such as sweating or shakiness. A possible side effect is pancreatitis, or inflammation of the pancreas. That causes abdominal pain. GLP-1 RAs. The next group of medications is glucagon-like peptide-1 receptor agonists, or GLP-1 RAs. Medications in this class include exenatide, or Byetta Bydureon, liraglutide, brand name Saxenda or Victoza, dulaglutide, brand name Trulicity, and semaglutide, brand names Rybelsus or Ozempic. GLP-1 is a hormone in your body that tells the body to make more insulin when blood sugar is high. These medications act like GLP-1 and thus increase insulin. They also slow down your digestive system so that you don't feel as hungry. That's why they do cause some weight loss, which is helpful for many people with diabetes. GLP-1 RAs may reduce the risk of heart attack and stroke. Most of these medications are injections. Possible side effects include an upset stomach, like nausea, vomiting, and diarrhea, which are typically temporary and go away with time. Very rarely, these medications can increase the risk of pancreatitis or inflammation of the pancreas, especially if you have high triglycerides. You should avoid these medications if you have a family or personal history of thyroid cancer. SGLT2 inhibitors. The next type of medications is called sodium glucose cotransporter 2, or SGLT2 inhibitors. Medications in this class include canagliflozin, brand name Invokana, dapagliflozin, brand name Farxiga, and empagliflozin, brand name Jardiance. These medications help your kidneys get rid of extra blood sugar by helping the sugar come out in the urine. Extra sugar in the urine can lead to some side effects like urinating frequently and higher risk of urinary tract infections and yeast infections. It's important to stay hydrated and maintain good hygiene to minimize risk of these side effects. This class of medication may be helpful for people with heart disease, heart failure, and kidney disease. Sulfonylureas. Next, we'll talk about sulfonylureas. This group of medications includes glimepiride, brand name Amaryl, glipizide, brand name Glucotrol, and glyburide, brand name Diabeta. Sulfonylureas tell your body to make more insulin at lower sugar levels. Remember, insulin helps sugar get inside the cells so it can be used for energy. These medications should be taken before meals. Side effects include an upset stomach and weight gain. There is also a risk of hypoglycemia with these medications, which means blood sugar can drop below the normal range and cause uncomfortable symptoms. You can learn more about hypoglycemia in the problem-solving section. Next group of medications is meglitinides. Examples are nataglinide, brand name Starlix, and repaglinide, brand name Prandon. Meglitinides work by telling your body to make more insulin, similar to the sulfonylurea medications. Also similar to sulfonylureas, possible side effects include weight gain and hypoglycemia, or blood sugar dropping below normal. These medications are to be taken before each meal as well. The next group of medications is the thiazolidinediones, or TZDs. Examples of TZDs are rosiglitazone, brand name Avandia, and pioglitazone, brand name Actos. TZDs help your body's cells respond better to insulin, which lets sugar out of the blood and into the cells so it can be used for energy. These medications also lower blood sugar by stopping the liver from making sugar. Some people at risk of heart failure or heart attack should not use these medications. For those who can use these medications, they work well, but side effects can include headaches, excess fluid, and weight gain. Alpha-glucosidase inhibitors are the next type of medications. Examples are acarbose, brand name Precos, and Maglitol, brand name Glycet. These medications are taken as soon as you are starting a meal and work by slowing down the breakdown of carbohydrates, so that your blood sugar levels do not rise as quickly after eating. This means the sugars stay inside your intestines, which can lead to side effects of gas, bloating, and diarrhea. Insulin therapy. Insulin is another type of treatment for diabetes. Taking insulin directly adds to the natural insulin your body makes to help sugars get from your blood into your body's cells to be used as energy. There are different types of insulin. Some are long-acting, taken 1 or 2 times per day to keep your blood sugars in a good range. Examples of long-acting insulin include glargine, brand names are Lantus, Toujeo, and Basaglar, Danamir, brand name Levemir, Degludec, brand name Tresiba. Sometimes, people also need short-acting insulin with meals to counteract the sugar eaten during the meal. Examples of short-acting insulin include Aspart, brand name Novolog, Glulisine, brand name Epidra, Lispro, brand name Humalog, and regular insulin, brand names Humulin and Novolin, or NPH. Checking your blood sugar is usually required if you use insulin. Insulin is taken by injecting it into the skin. Side effects include weight gain and hypoglycemia, or blood sugars getting too low. Cost of medication can be a big problem for a lot of people. Cost varies a lot from medication to medication, and even can be different at different pharmacies. Some tips for finding lower-cost medications include looking for the generic version, not the brand name. Your doctor may need to fill out a prior authorization, which tells your insurance company how necessary that medication is for you. It can take 3 to 5 business days to complete. If you don't have insurance, ask if there's a patient assistance program that you may qualify for. Or use GoodRx, a free website or smartphone app that lets you search for coupons and discounts. If you're having trouble affording your medication, talk to your doctor or staff at your doctor's office.